friends, today our topic of discussion is on the meningitis. So what is meningitis? It is clear from the word only. Itis means inflammation. Meningitis means inflammation of meninges. That means the protective membrane of your brain and spinal cord. So what is it? We can say meningitis is the disease caused by the inflammation of the protective membranes covering the brain and spinal cord, known as meninges. Okay. So the inflammation of the brain and the spinal cord membrane typically caused by infection. So the meningitis is usually caused by the viral infection, but can also be bacterial or fungal. Okay. Let's discuss in detail. See, meningitis is the inflammation of the arachnoid and the pia mater of the brain and spinal cord. What is arachnoid and pia mater? See, meninges have three layers. First is dura mater, arachnoid mater and the pia mater. Dura mater is the outer layer closest to your skull, whereas arachnoid mater, this is the middle layer, and the pia mater is the inner layer closest to your brain tissues. Clear? So the meningitis is the inflammation of the arachnoid and the pia mater of the brain and spinal cord. Meningitis is caused by bacterial and the viral organisms, although the fungal and the protozoal meningitis also occurs. Predisposing factors include skull fracture, brain and or spinal surgery, sinus or upper respiratory infections, the use of the nasal sprays, and the individuals with the compromised immune system. Next, how we can diagnose this disease? We can diagnose this disease with the help of CSF analysis. That means cerebrospinal fluid is analyzed to determine the diagnosis and the type of meningitis. Clear? Next, transmission. That means how this disease is transferred from one person to another. Or we can say this infectious disease is commonly spread through the direct transfer of these pathogens from one person to another. Okay, how? Let's discuss. The transmission is by the direct contact, including the droplet spread. That means the pathogen that causes the meningitis are transmitted from the person to person through the droplets of respiratory or throat secretions from carriers. Or we can say a close and prolonged contact such as kissing, sneezing or coughing on someone or living in a close quarters with an infected person facilitates the spread of these diseases. Okay, so the transmission occurs in the areas of high population density, crowded living areas, etc. Clear? So this is all about the transmission. Next, assessment. How we can assess this disease? First of all, there will be a mild lethargy. Mild lethargy means the lack of energy or enthusiasm. Patient may have sleepiness. Okay. So memory changes will be there, short attention span, personality and behavioral changes will be there, severe headache, generalized muscle aches and pains, nausea and vomiting will be there, fever and chills, tachycardia, that means rapid heartbeat. Okay, so here you can see in these images, fever, patient having fever, sleepiness, headache, severe headache, light sensitivity, photophobia will be there. Okay, nausea and vomiting, joints pain, rashes, seizures, etc. Next, deterioration in the level of consciousness, photophobia as discussed, light sensitivity. The thing is the signs of meningeal irritation such as knuckle rigidity. Knuckle rigidity means patient may have severe neck stiffness, and the positive Kernick signs and the positive Brudzinski sign. These are the test. Especially the test to check the meningeal irritation. Here you can see what is this. Let's discuss one by one in detail. First is Kernick sign. Positive Kernick sign is a test used in the physical examinations to look for the evidence of irritation of meninges. So how we can perform this test? The test involves the flexing of the thighs at the hip and the knees at 90-degree angle. Okay, and assessing whether the subsequent extension, here you can see with the subsequent extension of the knees is painful, leading to resistance, in which case it is deemed positive. This indicates the subarachnoid hemorrhage or meningitis. Clear? So you can see here the resistance to extension of the leg while the hip is flexed is the Kernick sign. So the patient may also shows the opisthotonus. Here you can see in this image what is opisthotonus? The spasm of the whole body that leads to the legs and the head being bent back. Here you can see the head bent back while the body bowed forward. So this is opisthotonicity. See, especially we can see it in the Kernick sign, positive Kernick sign. Okay, so this is all about the Kernick sign, resistance to extension of the leg while the hip is flexed. Okay, there will be a pain. Second is Brudzinski signs. What is Brudzinski signs? Positive Brudzinski sign is one of the physically demonstrable symptom of meningitis. So what will be happen? The severe neck stiffness causes a patient's hips and knees to flex when the neck is flexed. It will be there. So how we can perform this? Here you can see the patient is in a supine position. What you have to do? Gently flex the neck, bringing the chin to the chest. With that, what will happen? The positive sign is involuntary flexing of the hips and the knees. Okay, so we can see the Brudzinski signs. What will be there? The flexion of the hips and the knees in response to neck flexion. When we do the neck flexion, there will be an involuntary flexion of the hips and the knees. This is the positive Brudzinski signs. Clear? This is all about the Kernick sign and the Brudzinski signs. Next we will discuss next we will have the red macular rashes with the meningococcal meningitis. Patient may have abdominal and the chest pain with the viral meningitis. This is all about the assessment. Next we will discuss about the intervention, what you have to do for that. First of all, monitor the vital signs and the neurological signs. Assess for the signs of increased intracranial pressure. Initiate seizure precautions. Monitor for the seizures precaution. Monitor for signs of meningeal irritation. You can check it by the Kernick signs and the Brudzinski signs. Perform cranial nerve assessment. Assess the peripheral vascular status. Maintain isolation precautions as necessary with the bacterial meningitis to avoid the transmission of disease, and maintain the urine and the stool precautions with the viral meningitis, and maintain the respiratory isolation for the client with the pneumococcal meningitis, because as this disease is a droplet infection, it can spread. Okay, so you have to maintain the respiratory isolation. Elevate the head of the bed 30 degrees and avoid the neck flexion and extreme hip flexion. Prevent stimulation and restrict visitors. Administer analgesics as prescribed. Administer antibiotics as prescribed. Okay, so this is all about your interventions. So today we have discussed about meningitis, its transmission, its assessment, how we can assess this disease, and what are its interventions. Hope today's video is clear to you all. Thank you.